Welcome to OncoTrial Insights with Dr. Pidugu, the podcast that brings you the latest in clinical research and its impact on patient care. Today, we have a truly significant update in the world of oncology. We're going to be discussing the CheckMate 8HW trial, which is reshaping our understanding of how to treat a specific type of colorectal cancer. With me today is Dr. Pidugu. Welcome, Dr. Pidugu.
Thank you, Christina. It's great to be here. Just a quick heads up before we get started. The views expressed on this channel are solely my own and do not represent those of any institution, organization, or employer. This content is for educational and informational purposes only. Please consult your healthcare provider before making any healthcare decision. The information I will discuss is not meant to endorse or criticize any specific products or brands. My goal is to provide you with educational content, shedding light on various topics.
That's an important disclaimer, Dr. Pidugu. Now, let's dive into some exciting advancements in the treatment of colorectal cancer. A recent study published in the Lancet journal highlights the use of Nivolumab plus Ipilimumab versus Nivolumab in microsatellite instability, high metastatic colorectal cancer. Immunotherapy has really taken the spotlight in recent years. Why is it particularly relevant for MSI-H or dMMR colorectal cancers?
Great question. In 2025, an estimated 154,270 new cases of colorectal cancer, CRC, are expected in the United States, with approximately 52,270 deaths. Early detection significantly improves survival rates. The 5-year relative survival rates for colorectal cancer are localized disease, 91.5%, regional spread, 74.6%, distant metastases, 16.2%. Colorectal cancer continues to pose a significant global health challenge, accounting for approximately 10% of all cancer diagnoses. Around 15% of CRC cases are characterized by mismatch repair deficiency or high levels of microsatellite instability. These tumors generally have a more favorable prognosis than mismatch repair proficient pMMR CRC. However, in metastatic CRC, the proportion of dMMR or MSI-H tumors drops to about 4 to 5%. dMMR typically arises from inactivating mutations in key mismatch repair genes such as MSH2, MLH1, and MSH6. This leads to the accumulation of mismatched DNA bases and the generation of abnormal proteins that may be recognized as neoantigens by the immune system. Due to evolutionary selection pressures, these tumors often bypass apoptosis, even in the presence of critical DNA damage. Metastatic CRC with the dMMR or MSI-H status often exhibits a high tumor mutational burden, which enhances immunogenicity and improves the likelihood of response to immune checkpoint inhibitors. This subtype has shown robust and durable responses to immunotherapy, particularly agents such as Nivolumab and Ipilimumab.
That's a great overview. So, what exactly is the CheckMate 8HW trial investigating?
The CheckMate 8HW trial is a phase 3 randomized open-label international study. It's evaluating the efficacy and safety of immunotherapy treatments for patients with unresectable or metastatic colorectal cancer that has high microsatellite instability or MSI-H or is mismatch repair deficient dMMR. The trial has two primary goals. One, to compare Nivolumab plus Ipilimumab versus chemotherapy as a first-line treatment. And two, to compare the combination versus Nivolumab alone across all lines of therapy.
Got it. Why is this immunotherapy approach being prioritized for MSI-H or dMMR metastatic colorectal cancer?
That's an excellent question. Patients with MSI-H or dMMR metastatic colorectal cancer often have poor outcomes with traditional chemotherapy. The presence of MSI-H or dMMR status is actually associated with a higher number of mutations in the tumor, and this can make these cancers more likely to respond to immune checkpoint inhibitors. We have seen promising results in previous studies, like the phase 2 CheckMate 142 trial which showed good efficacy and manageable safety with Nivolumab plus Ipilimumab in this patient population.
So, these immune checkpoint inhibitors are really key here. Can you explain what Nivolumab and Ipilimumab are and how they work?
Certainly, Nivolumab and Ipilimumab are both immune checkpoint inhibitors that work by enhancing the body's immune response against cancer. Nivolumab is a PD-1 inhibitor, while Ipilimumab targets CTLA-4, which stands for cytotoxic T lymphocyte antigen 4. These molecules, PD-1 and CTLA-4, act as checkpoints on immune cells, helping prevent them from attacking normal tissues. Unfortunately, cancer cells can hijack these checkpoints to avoid detection and destruction by the immune system. By blocking PD-1, Nivolumab prevents its interaction with PD-L1, a protein expressed by some tumors, and helps reactivate exhausted T cells. Ipilimumab, on the other hand, blocks CTLA-4, lifting another brake on T cell activation. Together, these drugs release the immune system's inhibitory brakes, enabling it to better recognize and attack tumor cells. This approach is particularly effective in tumors that are mismatch repair deficient, dMMR, or have high microsatellite instability, MSI-H. These tumors harbor numerous mutations, leading to the production of abnormal proteins that the immune system can recognize as foreign. As a result, they are especially well suited for immune checkpoint blockade with agents like Nivolumab and Ipilimumab. Combining both therapies targets different regulatory pathways, producing a more robust and sustained anti-tumor immune response.
That's a fantastic explanation. It's like taking the handcuffs off the immune system so it can fight the cancer. Now, let's get to the recent findings. What were the main findings of the CheckMate 8HW trial regarding Nivolumab plus Ipilimumab versus Nivolumab alone?
The pre-specified interim analysis of CheckMate 8HW demonstrated a significant and clinically meaningful improvement in progression-free survival, or PFS, with Nivolumab plus Ipilimumab compared to Nivolumab alone. This was observed in patients with centrally confirmed MSI-H or dMMR metastatic colorectal cancer across all treatment lines. The median PFS was not reached in the Nivolumab plus Ipilimumab group, while it was 39.3 months in the Nivolumab group. The objective response rate, ORR, was also significantly higher with the combination therapy at 71%, compared to Nivolumab monotherapy at 58%.
Not reached for median PFS is incredibly impressive. That speaks to the long-term benefit. And how did Nivolumab plus Ipilimumab compare to traditional chemotherapy in the first-line setting?
Based on a previous interim analysis and updated longer follow-up data, Nivolumab plus Ipilimumab showed superior progression-free survival compared to chemotherapy as a first-line treatment for these patients. The median PFS was significantly longer with the combination therapy at 54.1 months compared to a mere 5.9 months with the chemotherapy. This clearly indicates a substantial benefit for patients receiving the immunotherapy combination as their initial treatment.
Those are striking numbers. A median PFS of 54.1 months versus 5.9 months is a game changer. As always, efficacy is only half the story. What about the safety profile of Nivolumab plus Ipilimumab in this study?
Yes, as expected with dual immunotherapy, there were more treatment-related adverse events. TRIs, 81% of patients experienced them compared to 71% on Nivolumab alone. Grade 3 or 4 TRIs occurred in 22% with the combination versus 14% with the monotherapy. Common side effects included pruritus, diarrhea, and hypothyroidism. Although treatment-related adverse events leading to treatment discontinuation were higher with the combination, it was still manageable.
It's reassuring that the safety profile, though more intense, remained manageable. Did the treatment affect patients' quality of life?
Importantly, improvements from baseline in health-related quality of life, as measured by the EORTC-QLQC 30 Global Health Status Scale, were observed in both the Nivolumab plus Ipilimumab and Nivolumab groups. The combination therapy group reached the threshold for meaningful change in quality of life earlier and maintained it at most time points. This suggests that the efficacy benefits of Nivolumab plus Ipilimumab were not achieved at the expense of diminished health-related quality of life.
That's crucial. It's not just about extending life, but also about the quality of that extended life. So, Dr. Pidugu, what do these results mean for the treatment landscape of MSI-H or dMMR metastatic colorectal cancer?
The results of the CheckMate 8HW trial strongly suggest that Nivolumab plus Ipilimumab is a potential new standard of care for patients with MSI-H or dMMR metastatic colorectal cancer. The demonstrated superiority in progression-free survival and objective response rates compared to both Nivolumab monotherapy and chemotherapy, coupled with a manageable safety profile and maintained health-related quality of life, really supports the use of this dual-agent immunotherapy combination across different lines of therapy in this patient population.
Every study has its limitations. What should we be mindful of here?
The open-label design could introduce potential biases in reporting, although the high concordance between blinded independent central review and investigator assessment of PFS mitigates this concern for efficacy endpoints. Some secondary endpoints, including duration of response and overall survival, are not yet mature at this interim analysis. Subgroup analyses in some cases had low patient numbers, limiting definitive interpretation. Efficacy outcomes by line of therapy remain masked at this time.
And what about future directions?
Continued follow-up is needed to assess overall survival and mature secondary endpoints such as duration of response. Further biomarker analyses are planned to explore correlations between radiographic response and circulating tumor DNA. Exploration of the hypothesis that a proportion of patients may achieve a cure with the dual agent combination.
This is truly exciting news for patients. Thank you so much, Dr. Pidugu, for breaking down these complex findings for us.
It's my pleasure, Christina. It's vital for patients and their families to stay informed about these kinds of advancements.
That wraps up our conversation with Dr. Pidugu on the groundbreaking CheckMate 8HW trial and what it means for patients with microsatellite instability high, metastatic colorectal cancer. Thanks for joining us on OncoTrial Insights with Dr. Pidugu. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with your colleagues or anyone who might find it helpful. We'll be back soon with more updates on the latest clinical trials and advances in cancer care. Until then, stay curious, stay informed, and keep pushing for better outcomes.